The history of medical experimentation on people that are incarcerated and enslaved dates back to the early years of slavery in the United States. One example is J. Marion Sims, an early gynecologist of the 1800s that performed experiments on Black enslaved women without anesthesia to achieve his quote-unquote breakthroughs. The stories unfortunately continue. There is a book by Harriet Washington entitled Medical Apartheid that documents medical experimentation on Black Americans who also make up a large percentage of the incarcerated population today. Many people categorize incarceration today as modern-day slavery or the new Jim Crow because U.S. prisons are full of majority people of color, especially affecting Black and brown people that are dehumanized in various ways and often forced to work for little to no pay.
As early as 1934, a program at Leavenworth Prison in Kansas was established to test the effects of drug abuse with incarcerated people as test subjects. But it wasn't until after World War II, when Douglas MacArthur, the Supreme Commander for the Allied Powers, pardoned war criminals that conducted human experiments in exchange for a part of the research results, that the government officially condoned human experiments. Over the following decades, numerous experimentation on the incarcerated only accelerated, and by 1972, more than 90% of investigational drug toxicity testing was conducted on prisoners. Between 1951 and the mid-70s, HeLa cells were injected into a variety of patients, including incarcerated people, to see if they caused cancer. The patients were told that they were receiving cancer treatment. Another program at Tuskegee, injecting syphilis in the incarcerated people for over 4 decades to see the long-term effect of untreated syphilis, which ran from 1932 to 1972, only targeted the African American population. Are these measures not cruel and unusual? Even though the Congress created the National Commission for the Protection of Human Subjects of Biomedical and Behavior Research in 1974, experiments on incarcerated people didn't stop there. Even if they could turn to the courtroom to get their justice, the returning citizens practically has no chance in winning it fair. With the companies financially backing up the researchers, the returning citizens don't have the power or money to fight a court case long enough. As such was the case with Dr. Albert Kligman, creator of Retina, acne medication.
Now, let's move on to the numbers. Here's the overview of general data on incarceration. As we can see on the pie chart, the rate of incarceration in the United States is 698 per 100,000 residents. Within this massive population, many of them are not incarcerated due to what they've done. 74% of people held in jail have not been convicted of any crime. If we relate this chart with the previous one, it is a huge number for us to believe how many people behind bars aren't supposed to be there. This is the racial disparity rates on incarceration in 2018. We can clearly see the differences between ethnicities. The numbers of Black population tripled the number of white population under incarceration, and the Native Americans doubled the number of white population under incarceration. The poorest population under incarceration are women and people of color. Based on the historical aspect of American law and probation systems, many people of color were behind bars because of the prison industrial complex. As we know from the history of experiments on incarcerated people, the jail was being used as a testing center. The people were being treated as test subjects. Now, we have to ask ourselves a question. Who exactly is being tested under these experiments? After seeing a data on incarcerated populations, we know that most of them are people that haven't really committed a crime, people of color and from low-income communities, and women. Whether it's voluntarily or involuntarily, it is obvious that the unjust system has marginalized certain groups as testants.
Medical experimentation can also be seen in how U.S. prisons have handled the influx of COVID-19 cases over the past year and a half. The amount of COVID cases in prisons has always been high and has been reported on mainly by the Marshall Project, and currently the COVID Prison Project as seen here. Incarcerated journalist John Lennon published an article in September 2020 about the COVID conditions at Sing Sing Prison in New York. Incarcerated people were not taken seriously and immediately quarantined when they had COVID or related symptoms and were easily able to spread the virus. Real masks were not distributed immediately either. At one point, they were only receiving cloths. And the cycle of people of color being the most vulnerable and high risk continues, as calls for the release of incarcerated people due to COVID caused mostly white people to be released in this Illinois prison. We can assume that the proportions may be similar in other states.
From the information and data presented in this video about historical and current medical experimentations on enslaved and incarcerated people, it is clear to see that awareness and a call to action are necessary. To stop history from repeating itself, we all must advocate for every human being's right to bodily autonomy, safety, and humanization.